Hi, this is Brooke Lounsbury, registered nurse and expert contributor at CaringVillage. Each week I answer your questions about caregiving and offer tips and solutions. Medical disclaimer: although I am a nurse by profession, I am not your nurse. All content and information shared is for informational purposes and educational purposes only. It does not constitute medical advice and does not establish any kind of patient-client relationship. Always consult a professional who is aware of all the facts and circumstances of your individual situation before making any changes or decisions about your health or well-being. Today's question comes from Trevor.
My wife has been in stage 2 dementia for a few years. I have been her sole caregiver for the past 5 months and I'm feeling trapped and resentful. Don't get me wrong, I love her very much, but the day-to-day grind is getting to me. Is this normal? I'm afraid I may snap if I don't get help soon.
Trevor, I am so glad that you reached out to CaringVillage. Depression is a very common issue among caregivers, with an astounding rate of 40 to 70% of caregivers that experience depression. And the prevalence of depression is particularly high for those caring for individuals with Alzheimer's or other dementias. There's a lot of people out there. It's an extremely hard road that you're traveling, and I commend you for it. But you do need to take care of yourself. There are some symptoms in caregivers that I want you to listen to and see if this sounds like you. If so, we do have some resources at the bottom that you can click on and to hopefully help you find your way, or anybody else who's listening to this. Here we go. Some of the common symptoms of depression include feelings of emptiness, hopelessness, irritability, and a lack of interest in activities that they once enjoyed. Physical symptoms such as changes in appetite, weight fluctuations, and sleep disturbances. You also may experience fatigue, anxiety, and difficulty concentrating, which can further exacerbate your mental health. Now, the emotional and physical demands of caregiving can lead to caregiver burnout, and this is a state of a physical, emotional, and mental exhaustion. And there is a very high risk of caregiver burnout, and these can manifest as feelings of being overwhelmed, withdrawn, or anxious, and they can really impact your ability to provide effective care. If you notice that you're having some of these problems, continue to listen on and also to reach out and to not feel ashamed or anything else, because it is a very common and overwhelming problem, especially in our day and age where people are busy and you're pretty much left on your own as a caregiver. So let's get started. First of all, you want to have self-care and prioritize your personal health. Maintain a balanced diet. Plan your diet. Engage in regular physical activity. That means getting out and going on a walk or something before you start your day or afterwards. Find ways to decompress that way. Also, make time for hobbies and activities that bring you joy and relaxation. If you're able to find respite care services, they can provide temporary relief, which can allow you to recharge and attend to your needs. And I will have a list of places that you can access to find respite care and support services at the bottom of this, or the very end of this podcast. Another thing to do is to access professional help. Seeking counseling or therapy can be beneficial for caregivers experiencing depression. Mental health professionals can provide coping strategies and, if necessary, prescribe medication to help manage symptoms. Many offices now offer online appointments if you are unable to manage a trip to the office. Prioritize and organize. This is for time management, organizing daily tasks and setting realistic goals, not overwhelming yourself or your wife. That can help you manage your responsibilities more effectively and reduce feelings of being overwhelmed. And don't forget social connections. Maintain social connections. This is vital for your mental health. Engaging in face-to-face interactions like coffee with friends and family, or have somebody come over and visit for a little while, can improve your mood and provide that sense of community that you so desperately need. Now, there are a few things you can do, and one of them is to consider joining a support group. Because of the unique caregiving that you're doing with your wife as the caregiver of a dementia patient, there's some specific emotional support and practical advice that you can get from others in similar situations that others might not understand. These groups offer a space for you to share your experiences and coping strategies. And like I said, as a caregiver for someone with dementia, you are faced with unique challenges. And there are groups across the nation and even local in some instances that can help. Now, caregiver support groups can help by being a safe space for you to express and share experiences and concerns, that emotional support that you do need, and offer practical tips and resources as your loved one goes through the stages of dementia. Now, down below here, I have listed a few resources for support groups. One of them is an Alzheimer's Connected.org group, and that one is a really good one. They have chapters all over the nation, online and in-person groups. Give it a look and just see what you can find over there. Another one that's very interesting that I found was called the Hope Health Caregiver Support Group. They are similar to the Alzheimer's group, and they do work with Alzheimer's and dementia patients and their caregivers, so give that one a look. Another thing is to check with your wife's insurance for caregiver respite. If she was a veteran, the Veterans Association can help in some instances cover costs of respite care, even if it's in the home or at a short-term stay facility. In addition, reach out to your wife's Medicare or Medicaid provider if she has it. They may be able to help. And we wish you the best of luck with what you're going through. If you have a caregiving question or concern, please submit your questions by leaving a comment below or fill out our form at www.caringvillage.com/questions. I look forward to hearing from you. Until next week.